Ladies and gentlemen, boys and girls, welcome back to the Medicare Sales Playbook. I'm your host, Dallas Keithley, and we are here live in Plano, Texas. And we're at the 8% conference. If you guys get a chance to go to anything 8% related, grab it, do it, hold on to it, and be ready for a great ride. But we are here. I got the chance to do a breakout this morning with a lot of the agents in this area, and we talked about cross-selling Medicare, had a great time, and we wanted to bring it to you. So we recorded this podcast live. Adam's editing, he's doing all the magic stuff, making me look good, but we did it live here in Plano. We hope you enjoy it. We're gonna throw out some links during the podcast. Be sure and check those out in the description, the cross-selling sheet, all of the Elevate stuff that we talked about, it's all there. So we hope this helps. We hope you get something out of it, you use it. Do me a favor, if you use it and it works, let me know. That encourages us and helps us keep going. Like, subscribe, comment, let us know who should be on the podcast. Hope you guys enjoy this. Let's have a great week. So my name is Dallas Keithley and I'm with the Medicare Sales Playbook. We are a podcast. The only thing I'm going to pitch today, I'm going to ask you to do today is to like, subscribe, listen, comment, all the good things, and then tell me who you want to see on the podcast. If you go to MedicareSalesPlaybook.com, there is a button that you can mash, as my Meemaw used to say. You mash that button and it'll say suggest a topic or suggest a guest. We want to talk to people that have made an influence in your life. So if you're sitting there today thinking, hey, who do I know that really helped me in the business? Casey, this is where you're supposed to say Dallas. No, okay. Who do I know that's really helped me in the business? That would be someone that we would want to meet. But let's get down to the meat of it here today. We want to talk today to individuals that have been in the business for a while, that have been making a difference in their communities, that have been killing it in the insurance world. We want you to learn from them. That's what the podcast is all about, helping people learn from people that are in the business. So we're really going to talk about two things today. We're going to talk about marketing, and then we're going to talk about cross-selling, because what's the hardest thing to do in this industry? Get in front of people, right? Yeah, I have people tell me all the time. This gentleman just told me, he said, I don't have a money problem, I have a people problem. I need to get in front of more people. And I hear agents say all the time, man, Dallas, I can sell ice to Eskimos, all that stuff. If you don't have Eskimos, it doesn't matter what kind of ice you have, right? You got to get in front of people. I can send my dogs into 10 houses and they come out with 3 applications. So it's getting in front of people. Then the second part is, once you get in front of somebody, you got to make the most of it. I'm going to challenge you today. Anybody in here just do Medicare? Anybody? Just do Medicare. I'm going to challenge you today to get outside your comfort zone and either learn more about the business of insurance and adapt and grow, or I'm going to challenge you to add people to your team that can help you adapt and grow. What if I told you that, I don't know if we can say that, that's an ESPN thing. What if I told you that I could solve your marketing money problems with 2 applications? Anybody interested? I'll show you how to do it. My daughter just did, okay? Casey pays for all of her marketing through what I'm going to show you today. Is that fair to say?
Fair.
All right. Great input. Yes.
Super official.
Yeah, exactly.
Hello.
Is there anybody else that would like to be up here? No, I'm just kidding. All right, let's introduce these guys. Casy Askins is out of Kansas City, Missouri. I've known Casey her entire life. There is a good chance I've changed her diaper when she was a kid. But Casey is a worker. Casey, tell us how long you've been in the business, what you're doing now, that kind of stuff.
Yeah, I got in the business November of 2022. So I've been in the business a little over 2.5 years. And I got in the space just focusing on Medicare. That was the only thing I did, was I wanted to master what Medicare was, because there's a lot to Medicare and it's really scary. And in the past, I would say 1.5 years, I've been able to add products and cross-sell and really take the business to a whole new level than I had thought. And so, yeah, I do Medicare seminars. I mainly do Medicare, retirement, hospital, cancer, things like that.
Yeah, what's your income going to be year 3?
I hope my income, I'm going to take away hope. My income will be over $500,000 in my 3rd year.
3rd year. All right. That's Casy Askins, ladies and gentlemen. Make her welcome there. There we go. Audience participation. Guys, for those of you on the podcast, that's not recorded. This is a live studio audience. Here we go. Up next, we have Caroline Trecartin. Caroline, I got the pleasure of helping Caroline get into the Medicare business. And I don't take any credit for that. But man, this kid, Caroline, what were you writing in life insurance sales prior to going to Medicare? What was an average month?
I was doing $35,000 a month in annual premium.
Why get into Medicare? Chris Ball's still mad at me.
I know. They say I turned to the dark side going to Medicare.
Way better side.
It is a way better side, honestly. I switched into Medicare because I was doing so well at life insurance and earning a very good income. But the thing with life insurance is that if you want to keep earning income, you have to keep producing. And so when I switched to Medicare, my income started dropping because I wasn't producing in life insurance, which just showed me this is why I got into Medicare in the first place, to start building that residual income, because Medicare pays you year after year after year. So after a couple of years of really hard work and lots of production, then your residual income will just keep coming in and you can start taking days off of work.
Yeah.
Beautiful. That's the goal, right? Buy back the time.
Yeah.
Love it. And then lastly, I usually say, but not, no. Josh Burns. I've known Josh a long, long time. You got in the business how long ago?
17-ish years ago.
17 years ago, captive agent with Mutual of Omaha. That's where we met.
Yes.
And then now he owns an agency called Capstone Insurance Services in Jackson, Mississippi. Great office down there. Talk about, Josh, what changed for you as you went independent? What was the thing that really made your business take off?
So going from captive to independently, it's what kind of lead source that you can have. So we basically dove straight into doing the Medicare seminars from that point forward. And that's pretty much all we do is Medicare seminars. And from there, we just drive in all the cross-selling from the annuity pieces to the hospital indemnity plans, all that good stuff. But the annuity sides is where we really push hard on the cross-sell piece. Perfect.
All right. Well, let's jump right into it. Let's get in the meat. Let's talk Medicare seminars. How many of you in here have ever done a Medicare seminar? Beautiful, right? Okay. Medicare seminars, in my opinion, the reason we do Medicare seminars, I've gone all over the country helping people do them now. I believe they're one of the most effective ways to get in front of a lot of people very quickly. But the big thing that a Medicare seminar does, when you stand up in front of a room of people and you talk to them for an hour about what is Medicare, I want to cover three things. What is Medicare? What does Medicare cover and not cover? How do I cover what Medicare doesn't? I do not want to vomit on them about the Act of 1942 and yada, 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 right? I want to make it very, very simple. My goal, and it happens almost every time, at the end of a seminar, somebody walks up to me and says, I've been to 9 of these things, and I've never heard it that simple. That's my goal every time, right? And it happens almost every time. It's not because I'm that good. It's because we have simplified it and made it very easily understandable, right? So as we look into Medicare seminars, Josh, I'll start with you. When you're starting to prepare for a Medicare seminar, the first thing is finding the location, right? You want to find the right location. So if you're looking for a seminar location, what are you looking for?
So for me, I actually take it a step further back. I actually call the lead vendor that we use, and we start pulling zip codes and see what kind of radius that we can actually go out and see how many people we can drive out of that actual location from there. And then from there, for me, we just try to find, I don't do the Golden Corral stuff anymore. I hate those. So we usually try to find like maybe a Mexican restaurant. We do it on the coast. We find a little seafood place there. But before we even actually book anything, because Medicare only allows us to spend so much money per individual, so we got to make sure that they're flexible within their menu. From there, they have to do that location.
Yeah, because the thing with finding a location, I do love a buffet as a business owner. As a person, I hate buffets.
Yes.
Can't do it. I'm eating other people's leftovers. But as a seminar, I like a buffet. It keeps the waiter out, right? Saying, hey, who had the filet, right? Also, you guys stick around the $15 mark. For those that, if you're with CMS, you got to tell me in here, okay? You got to stick around the $15 mark. Casey, when it comes to looking at the $15 mark, very hard to do. We want to stay close to that. And I'm putting you on camera saying this so that I don't get in trouble. How do you do that?
Edit this out.
What do you do?
I hate what?
when it comes to the menu, what do you do? What are you looking for?
Yeah. So the $15 mark is super hard. But what we have found out that works is we go to the same 2 or 3 restaurants every single month, every other month for 2.5 years. So we know that manager extremely, extremely well, and we've gotten really close with them. So we work out a deal with them. Hey, we're going to come here every other month. We need this to be $15 a head, and they work with us, or they give us 10 free buffets free, or whatever that may be. We've worked out a really great deal, and we typically are trying to not pay for it. So we have carriers pay for it, or we have senior primary care facilities pay for it, where that's not coming out of our pocket. That's all on them.
Okay, talk a little bit more about that, because some people just went, what? Right? Because let's say if you're doing a seminar and you get 100 people to show up, that's $1,500 if I'm doing my math right. How are you getting, how are you getting people to pay for that? You said other people are paying for it. Go into a little more detail on that.
Yeah, so we use a Centerwell Senior Primary Care Facility and carriers. So Centerwell, we're really close with the broker manager in Kansas City. He's a massive Dallas Cowboy fan in Kansas City, so we're even really tight. But he's awesome, and we send a lot of people to their facility, and the goal is obviously they're going to help us and we're going to help them. So we send a lot of people their way for a primary care, and then they're willing to come pay for our seminar. And we allow them to talk at the 10 to 15 minutes at the end of the seminar, give a pitch of who is Centerwell, what do they do, and how can they benefit. And then another carrier that's new to Kansas and Missouri is Devoted, and they're really wanting to help because they're new to the market and they're wanting to get people. So they pay for our seminars, and then we have 6 downline agents, and they're coming and paying for their seminars. And they've been really incredible. I think the biggest thing is start building those relationships, and the more relationships you build with carriers or broker managers or primary care facilities, they're willing to come and pay for those in exchange to get people in the door.
Yeah, and guys, I've worked with across the country, Archwell, where was I at with Archwell? Nebraska.
Oak Street Health.
Oak Street Health, Sage Healthcare. I would just look up primary doctors, primary care facilities that specialize in Medicare.
And take the broker manager to lunch.
Yeah.
We went to Panera and we just started talking. And 2.5 years later, we're close. They're great. They sponsor most of our events.
I would even say have them come to your event, because every agent comes to their Aetna rep and says, hey, I am the next big deal, right? Like I will be your leader. And they're like, yeah, okay. But you invite them to an event where you've got 50 butts in seats, they're going to be like, okay, because guys, they make money when you make money, and they have money to spend on you, right? Everyone has a budget. And if you start showing them, hey, I'm going to produce apps, they will spend money on you.
And okay? Pete was like used to 10 to 15 people in the room, and he walked in and there was 60, 75 people. He's like, holy cow. Right. And then they were like, same thing.
Yeah. So Caroline, all 3 of you guys work with Brian Steppen, correct? Mm-hmm. Talk about the relationship you have with him. So Brian Steppen owns a company, Steps to Success. Talk about him and what he does for y'all.
Yeah, so he partners with Lasting Mark, and he does all of our mailers. Really great guy. He has all the data of the people turning 65 in the area. So when you connect with him, you can say, okay, perfect. I'm looking at doing T65 Medicare seminars. I live in Chicago. So I'm saying these are kind of the zip codes, the counties that I want to target. How many people are turning 65? He'll say, okay, Caroline, in the next 6 months, there's 6,000 people turning 65 within a 10-mile radius of you. He's really, really good with his data. And the really nice thing about him is if there's another agent in Chicago doing T65 seminars, he's not going to mail the same people that he mailed for me. So they're exclusive. But he's really good at kind of like advising you based on how many people are in your area turning 65 with, okay, I would do this end of the county, month 1, this end of the county, month 2, this end of the county, month 3, and then month 4, go back to here and kind of circulate through those 3, or maybe circulate through those 2, depending on if you're in a really rural area or an urban area and the demographic and all of that stuff. So he's really great to partner with. And the mailers, can I talk about like the cost of the mailers?
Yeah, do it.
The cost of the mailers with him really isn't all that bad. They end up being about 62 cents, 63 cents per mailer. So I'm personally mailing between 4,000 to 5,000 mailers each month. So it's not an inexpensive thing to do. You know, we're spending around $4,000 or $5,000 a month with the mailers and the food. So it's definitely expensive, but it's the highest return you're going to get on your investment.
Yeah, talk about the numbers of the return,
So if you're mailing 5,000 people, for instance, we're hoping to get between 1% to 2% of those 5,000 RSVP to your seminar. So 1% of 5,000 is 50, 2% is 100. So we're really hoping to get between 50 to 100. Brian Steppen does a really good job. We're seeing that the RSVPs are closer to that 2% mark month after month. So let's say you do get 100 people RSVP to your seminar. You're hoping for about 70 or 80 of those to actually show up to the seminar. Me personally, and these guys have done a great job too, if you do a really good job at educating during the seminar, building trust, showing your credibility, guys, I'm getting like 1 or 2 people say no, that they don't want to work with me. Like, you're getting the majority of the people saying, yes, I want to meet with you, Caroline. I'd like to talk to you about my Medicare, and so forth.
Yeah.
So,
Josh, if you would talk about the importance of collecting the form. How do you collect the data from those folks? And then how do you follow up and reach out to them once they're, leave the seminar?
Gotcha. So I got a secret weapon at my seminar. My mom comes with me on my seminars. So she greets everybody on the registration part of it. When they come in, they check in. We sign them all in, and every one of them gets an actual booklet. Within that booklet has everything, that's all the slide stuff that we're going to hand out. Yep. But the main thing in there is a form that we ask them to fill out, name, address, all that fun stuff. And then at the bottom of it, at the end, what I ask for is for them to actually fill out the bottom sections. Do they want an appointment with us? They want to set one? Do they not want one? I always make a joke about that. But we always do it at the very end, and my mom basically is the gatekeeper, so they have to give them to them on the way out. I would say 90% of the time they're turning the sheets. You may have 1 or 2 people that are just not going to do that. They're your plate lickers. You're going to have that regardless. But I would say on close ratio, we're probably closing 50% of them right out of the gate. And matter of fact, we just got a phone call last week from a seminar we did 3 years ago that says, "Hey, I'm retiring. I'm ready to work with you." So there's a lot of longevity in that as well. So you may not close everybody from the get-go, but you will have them trickle in over the next 12, 18, 36 months.
Yeah, perfect. Any questions on Medicare seminars right now? Yes.
What was the name of the member that you used?
Yes, the name of the member.
Step to Success.
Step to Success.
2 is the number 2.
Yeah.
2, the number 2.
Brian Steppen out of Florida. Yes, sir.
You guys do you have any data on best days of the week, best times to do events?
Yeah, his question was, what are the best days to work it? In my opinion, Tuesday, Wednesday, Thursday. Mondays, people are trying to survive, right? They just want to go home. Friday, they don't want to go hear about Medicare. Anything different from y'all?
We only do Tuesday, Thursday.
Tuesday, Thursday.
Tuesday, Thursday as well.
11:30 to 1 for lunch and 5:30 to 7 for dinner. You want to catch them before. You want to catch them before they go home. So if it's at 6:30, they're going home and they're probably not coming back. So we do 5:30. They can head home, stop on their way home.
How long are your seminars lasting?
They're 5:30 to 7 and then 11:30 to 1. We talk for 1 hour, but obviously there's ordering. We do a break halfway through. Kelsey talks in the beginning, the end. So they're a full hour and a half, but presenting is 1 hour.
Beautiful. All right. I want to jump into the next thing because I want to give it some time here. Cross-selling. We believe heavily, and when I say we, Lasting Mark, we have an FMO called Lasting Mark. We believe heavily in cross-selling compliantly. All right? I want that on the camera. Compliantly cross-selling out of Medicare. Now, like I said, there's some of you in here that are like, Dallas, you know what? I only do Medicare. I'm good at Medicare. I love doing Medicare. One, I consider hospital indemnity, cancer, heart attack, stroke to be a part of Medicare. Yes. You should be doing that, okay? But what I want to talk about is going into life insurance, even going into annuities, stuff like that. Anybody in here selling annuities in a Medicare home? 2, 3 people, 4 people. Guys, there's never been a better time to sell an annuity in the history of mankind. You can Google that. That's on Facebook. 2, you're sitting in front of people that are, their number one concern is their health insurance. Their second concern is outliving their money. Why not address both? And we're going to show you how to do it. So as we get into cross-selling, we developed this sheet right here. Don't worry about scanning that. I'm going to give you a QR code to scan. You can take this sheet and use it. Casey, let's start with you. How are you using this sheet? Explain what it is and what you're doing with it.
We do not call it a cross-selling sheet. We call it the things we do sheet, because cross-selling just will instantly raise a red flag. They get this sheet. Kelsey, my wife, at the end of the seminar, goes up and talks at the end and says, hey, here's Casey's an expert in a lot of things, but if Casey's the expert in Medicare, if Casey's not the expert in one of these things, we have someone a part of our team who is. And check this sheet, mark anything that you have more questions on or you want some clarity on, and then they turn that sheet in. They also see the sheet 20, 100,000 other times. As soon as they come into our office, 90% of our appointments are in office. And so as soon as they come into the office, just like you do at a doctor's office, they have to fill that sheet out before they come see me. My assistant, Amanda, gives them a sheet on a clipboard. They mark all the things they want to talk about. Then Amanda gives me that sheet. We go back and we have the Medicare, we do all their Medicare things, and then we kind of move. If they don't mark anything on the sheet, I still bring it up. And I still say, hey, who's your financial advisor? And I just take off and I just pitch my little spiel. Every email that I send and every email my assistant sends, this is I don't know what you call it, attachment that says click here if you want to know more of the products we do. So every single email that's coming out of our office has this attached to it. So they're seeing it every time they come into our office, every email, every seminar, everything.
Caroline, if you would, talk about how you are able to show things that aren't Medicare related compliantly to someone that you're sitting down with Medicare.
Yeah, absolutely. Well, Medicare does have a lot of compliance. So technically at a Medicare appointment, you're only supposed to talk about Medicare. Once you finish up the appointment, at the end of the appointment, you're all wrapping up, finishing up about Medicare, you're formally ending the appointment. And then you can start to bring up other things. Now, also with this cross-selling sheet, you guys have to use this. It's made it so easy to be able to open up that conversation to talk about other products. And I've been in the business for like 3 years. The first 2 years, I didn't cross-sell anything. Casey, I don't think you cross-sold at all. Because we were scared that, oh, well, we're going to sound pushy, we're going to sound salesy, oh, this person just wants more and more and more. But at the end of the day, everyone that I've cross-sold has said thank you to me. Like, thank you for showing me these products. I didn't even know about these. So these people need help. A lot of them are just scared to ask you, but then also they don't know that you do it. Yes. Brian Haskins says all the time, he learned to cross-sell when one client came up to him and said he did an annuity, and Brian was like, I do annuities. And he's like, you didn't tell me you do annuities. So you have to tell your clients what you do. And at the end of the presentation, just, open up that conversation and try to, start to book those appointments to sell those products at that first appointment.
Yeah, and when it comes to compliance, one thing, if I'm sitting down with a Medicare client and I'm talking to them and I've got this sheet out, at the end of the appointment I tell them, Mr. and Mrs. Smith, Medicare has a lot of rules. One of the big rules is I'm not allowed to sell you anything else today, right? Even if you say, Dallas, I didn't know you did life insurance, we need to talk about that. What we'll have to do is we've got to set up another appointment that I can come back, right? But there's nothing that says I can't let them know, here's what I do. Mm-hmm. And one thing that I love that they said was they get this sheet in front of them every chance they get. Every mailer that goes out, every time. If we have someone walk into our office for an appointment, the first thing the ladies at our front desk do is they hand them a clipboard with this on it. They say, listen, Mike will be right with you. While you're waiting, please fill this out. Right? Your doctor does it every time. Now, why is it important? Josh, talk about how something that might not be of interest today may be of interest to later because life changes and needs change, right?
It does. So I'm not as organized as the two ladies up here with this sheet. I've always done
Would have
something.
never guessed.
Organized chaos over here. But I will tell you, so I've created something that was a long time ago called the money bag. So that's really kind of how I've uncovered all the different assets and stuff in the house. So I'm a little bit, I go for the white elephants, for the bigger monies. So not that they don't need an HI or cancer or whatever, but so in our presentations, we take probably the first 35, 40 minutes and just really build that additional relationship with that individual. How are you, how long you been married, kids, grandkids, where'd you work, where'd you retire from, all that fun stuff. And it's usually one or two questions that we kind of dive into a little bit, and all of a sudden the clients will just start regurgitating all their stuff. They'll tell you where all the money's at, they'll tell you who their advisors are, and all that fun stuff. I'm usually not even writing notes. I'm actually keeping it all up there. When they're all done, then I'll start writing the notes down, and then we just start attacking them where they're vulnerable at, right? So when's the last time you met with your advisor, all that fun stuff.
Yeah. You guys, I love giving Josh a mic and then just watching everybody's face. Like, look, I don't write anything down. We attack them where they're vulnerable.
Like that?
Right? I love
It's
that.
all on video now.
It's all on video. And yeah, take that out of
One
video,
thing
please.
I will say is don't judge a book by its cover. It's
Yeah.
super easy to look like, oh, this person has no money. Those are the people that probably have the most money, and I can say that that is true.
Yeah, yeah. So, okay, now, hospital indemnity, cancer, to me, that should be presented every time. What percentage would you guys say, just real quick, do you place a hospital indemnity if you sell a Medicare Advantage plan? Don't ask Josh.
95%.
How much?
95%.
95%, yeah.
Ours is probably 50, 5 out of 10.
We're going to talk. I told you not to give him the mic.
But I got all the annuity stuff.
I would say mine was around 50% until June of this year.
What changed?
Casey Peterson came on our call and just told me how he pitches it. And since then, I'm probably 99%.
Awesome.
Since Casey Peterson came on June.
And y'all get ready for a tease. There's a podcast about that on the Medicare Sales Playbook. All
and
right?
it is good, and it changed my business.
Nice. Perfect. All right. I've got 5 minutes. Here's what happened to, or I've got 10 minutes, right? Here's what happened to us, guys. At Lasting Mark, we saw 3 years ago that we were not doing very many annuities. We were at a point, we did about 13 million. An agency our size, Josh will tell you, and he probably did about 9 million of that. That's garbage. So we started asking, why aren't you doing annuities? And if I were to ask the audience today, because we had 4 people say they're doing annuities, if I asked you guys, why aren't you? I would get the answer of, look, I do Medicare and I don't want to get into that field, right? I'm good at what I do and I don't want to branch out into that. 2, I'm scared, right? In Southwest Missouri, if you mess up somebody's money, they will kill you. Not figuratively, they will literally kill you. At very least, they're killing your dog. 3, they said, we just don't have the information. I don't know. I don't know what to ask. I don't know what to say. So we started training. There's a guy standing over here named Pat Schmidt that's going to talk next in this room about what he does. So I'm not going to spend a ton of time on this. But we gave people a vehicle to allow them to write more annuities. We opened up what we called the Elevate program. So here's what we do, and I'm going to ask these guys how they use it in just a second. If you're an agent with Lasting Mark, or if you are not an agent with Lasting Mark, you have an opportunity to use what we call the Elevate program. With the Elevate program, my daughter did it last week. We were sitting with a client. We started asking her, hey, are you worried about running out of money? Are you worried about long-term care? And she said, man, you hit it right on the head. Long-term care, that's what I'm worried about. We started talking about a bridge product with Equitrust, I believe. That shows you guys how much I know about it. We started talking about that product. Now, I could tell her everything I know about that product in just about the right amount of time that I just described the product here. But I said, hey, I've got a guy you need to talk to. And my daughter's like, listen, we're going to set up a Calendly. You're going to introduce you to Pat or Jay or Cole, someone on Pat's team. They are going to come in. They'll run the appointment. They're going to write an app. Shelby will get 50% of that commission. Talk about how much, real quick, we're running out of time. Casey, how often do you use the Elevate program?
We try and get every client at least one appointment with the retirement team. I would say I don't know what our percentage is by any means, but we at least pitch to every single client and we at least get a lot of those first appointments.
Yeah. Caroline, you've been sending people to the Elevate program, stuff like that. Talk about what it has done, because if you try to sell an annuity, you've established yourself as the Medicare person, Medicare person. What's it like being able to ship them to someone else that is an expert in that area?
Yeah, and clients like that you can show them that you're the Medicare expert. I say I'm the Medicare and the life insurance expert. Everything else we have people for that are absolutely phenomenal. And we have a great retirement team. I even mentioned their names, Pat, Jay, Cole, who will help you with your retirement. And it's completely complimentary. So it's just part of our process. We're not trying to switch you away from your current financial advisor or anything like that, but just trying to give you a second set of eyes to see if there's any gaps or blind spots in your retirement. And I just simply ask them, would you be open to a second set of eyes? And most of the time, like I would say 75% of the time, people will say yes. And I'll say it has and will completely continue to transform my business. I mean, the commissions are so large for these annuities, and I know zero about annuities. I sit on the calls with Pat and Jay, and I'm like just sitting there like, this is going all over my head. I have no idea what he's talking about, but I know he's helping my client. And it's important to be on the calls, first of all, because your client loves that. But they're really, really helping your clients. And for someone doing T65 seminars, it's so important to bring this up because they're retiring or they're going to be retiring soon. And they have money in 401ks and IRAs that they don't know what to do with. So a lot of times you can really help them, and you don't have to be an expert in everything.
I'll say one thing to that. The more products you sell, the better your retention is with that client too. So if you just have their Medicare Advantage, the likelihood that they're going to find a Joe Schmo on the street that sells a Medicare Advantage is super high. But if you have a Medicare Advantage, a hospital, a cancer, and an annuity with the retirement team, you're keeping that client because they have to find a lot more people to do that.
Yeah. Guys, I'm now going to show you, this is the Elevate Calendly. Now you say, Dallas, I'm not with Lasting Mark and all that. Josh, talk about how folks that are not with Lasting Mark can still use it and why.
Well, if you want to make some more money, definitely start calling Pat and the team on the retirement side. It's the beautiful part about that team right there is they don't just walk in and just start slamming products or illustrations in front of them. It becomes a more of a holistic approach. So you're not only now just getting maybe just an annuity, maybe now you're doing some long-term care cases. So it becomes a lot bigger case, if you will, when you start using a team like Pat's. That really knows that space, knows how to do it. And then you'll obviously at the end of the day, you'll see your paychecks get a lot bigger than that $600 for the HI or the MA plan. So
yeah. And the reason they're able to do that, even if you don't have a contract with them, we want to be fully transparent. If you use Pat and his team, what happens is if they write a policy, the business is paid to Lasting Mark, they cut you a check out of that and for your half, and that pays you, right? So that's how they're able to do it. Guys, I do have to wrap up here. I want to show you this. These are 5 agents of ours, Hunter, Rob, Danny Wisner, Casey, and Brett Boyd there. This is what we paid last year out of the Elevate program to those people. Casey, have you ever written an annuity application?
Never.
Yeah. And how much was that? That was yours.
I made $175,000 on it in my second year.
That's how you pay for your marketing for Medicare, is by bringing in other monies. You're allowing somebody else to do the presentation. Now, guys, here's what I would do if I were you. I would sit down, scan that QR code or whatever. Pat's about to do a presentation in here next. Boy, I am setting you up, buddy. Pat's about to do a presentation in here next. I would meet with this team and find out if you can trust them. I wouldn't send somebody to somebody that I didn't trust. I trust them because I know them and I've got to meet them. But I would find out if I can trust them, and then I would start sending my people on over. Guys, this is a QR code for the forms that we use today. Take that cross-selling form, brand it on your own. A lot of people ask me, Dallas, can you help me brand it? The answer is no, but I can give it to you and allow you to brand it, okay? Yes, sir, Andrew.
Hey, Dallas, I just want to mention something. You know, you guys are in the greatest room in the history of rooms, and I'll tell you why. First of all, this is the silver sky, right? So that means 4.1 million Americans change or turning 65 over the course of this year, next year, and then the following year, 4.8 million. So it's 11 or 12,000 people turning 65 every single day. Beyond that, they control $80 trillion. This is the largest wealth transfer in the history of mankind. To be able to use an annuity to transfer that wealth and avoid probate. And boy, you guys hit the nail on the head on everything you said. So I will tell you, this is the greatest time to be in this event. And you guys are absolutely the greatest industry in the world.
Pat, my wallet's in my bag right there. Just take it and give it to him, right? Yeah, appreciate that, Andrew. Yeah. Guys, if you didn't get the cord or whatever, it's the light wallet. Just don't use the red card. Here's our website, MedicareSalesPlaybook.com. We would love for you guys to like, subscribe. All the cool kids are doing it. And man, thank you very much for being here. Give it up for my guests today. I hope you got something from them. All right, and you guys are now all on the podcast if Adam says we can use this. So we hope we do. Thank you to Adam. Thank you guys for watching. Appreciate y'all. We'll see you next time on the Medicare Sales Playbook.